Hi, this is Matt Slimming with PT Pilot Billing and Revenue Cycle Management, and we're continuing on the video series of how to tweak a few things so that your cash flow can go from challenged to really abundant. And like most PTs, you probably started out with the best of expectations in opening your clinic, but once you were open and things got busy, you realize, wow, it's tougher to make a good profit than you thought it might be. But the good news is that you can make good profit by doing small changes consistently. And so we're going to talk about the second change today, and that is all about firing your payers. Firing your payers. When is it right to fire a payer? So, when you started, you were probably accepting every insurance you could, and they were all good, right? Because they were all bringing some cash to the table. But as you grew and you got busier, you suddenly realized, wow, I'm not making the profit I thought I was going to make. And part of the reason for that, for a lot of PTs, is because they accept a lot of visits with low price payers. These are payers, and it varies all across the country. We have people in the Northeast with Blue Cross who have terrible reimbursement. United Healthcare is low in a lot of places, Humana, ASH. There's a lot of different payers and some local payers that aren't national as well that don't pay very well. Well, how do you determine when it's time to let one of these payers go? Because we know that in these upcoming years, it's not going to be, the challenge isn't going to be in gaining lots of patients, lots of new patients, right? We know that if we're doing a few things correct from a marketing perspective, the patient volume isn't going to be the challenge in most regions, not in all regions. I know there are some very competitive regions out there, but in a lot of regions, patient volume isn't the challenge. It's how do we make a profit with the patient volume that we have, okay? And so when you look at your payers and you're trying to think, okay, which ones do I need to really think about letting go? Well, what we like to say is look at your expenses at about 80% of capacity. So when your clinic is running at about 80% of capacity, what are your expenses? Okay, so let's say that when you're at about 80% capacity, your expenses are around $25,000 a month. And look, it's going to be different depending on what region you're in, what kind of practice you have as well. And let's say at that 80%, I don't know, let's say you're seeing 400 visits in that month, okay? So your 80% expense divided by your 80% number of visits, and that is, one second, that is, I did the math before, $62.50, okay? $62.50. So that is your cost to see a patient. That's how much it costs you to see a patient. Now, obviously, that's not good enough. You need to make a profit. We know that profit in the future is going to be less than it has been. Traditionally, over many years, PT practices were making 25% profit, okay? We're less than that now. On average, we're less than that. Most clinics are less than 20%. So we say, okay, the very minimum that we need to make from our worst payers is 10% profit. So therefore, we need to, if we're going to make 10% profit on these worst payers, our income needs to be about $69.44. So let's say $70, okay? So when you look at your payers, look at the ones that are paying you less than $70 per visit. If you're billing correctly, there are some payers that pay a flat fee, some payers that pay per unit, but look at those when you're billing correctly and optimally, which ones are paying you less than 70. And when you look at those, we're going to start by thinking, okay, some of these, it might be time to cut out. Don't cut all of them out at once. Start with one, okay? Because your time as the practice owner should be initially spent on three things: treating patients, marketing, and management. Progressively, you should probably move to just marketing and management and ultimately just management. But right now, you're probably treating patients too. So you want to say, okay, I don't want to get rid of all my low paying payers, but I want to get rid of the worst one initially. Now, there are options, okay? Yes, you can potentially go back and renegotiate a better rate. That's a possibility. It's very uncommon. It's very difficult to do, particularly with these low payers. But if you have a niche practice, if you have something like, if you're doing something like women's health and you're the only one in the area doing it, if you're treating, Parkinson's in a special way with some big and loud programs and you're the only one out there doing it, or if you're in a different demographic where there just aren't many PT clinics yet, and I don't know many areas in the country like that, then maybe you can go to your payers and negotiate a better rate, but we rarely see that being done. So if you're not a niche practice, then you probably want to say, okay, let me look at my worst payer and let me take them out of the equation, let me fire them, and let me spend that time that I was spending treating those patients on managing better and marketing better, so I can drive volume increases for the type of payers that you most want. Okay, well, I hope that helps. I know it's scary to fire a payer, but we can't stay in business if we're all seeing payers that are delivering revenue below our cost. Okay, so be strong, be firm. You deserve to be paid well, at least 10% profit, and you can do this. Okay, good luck.